Hi, so my name's Sophie. I've got breath asthma, I've got adrenal insufficiency, I have depression, I have some heart things that are we're not really completely sure what's going on, but there's definitely something kind of things. That's me, and this is a video about my meds. I've just filled up my little dosset boxes, I guess they are. These are great, these are called pill folds, and inside they look like that, and they're full of my meds. And they're a good way of carrying on meds without it looking like a big deal. So, I take a lot of different tablets. So for my adrenal insufficiency, I take these, hydrocortisone. It's a steroid, it's not the muscle building kind. It's quite a nice steroid, much less side effects than the other steroid I'm on. It basically does what your adrenal glands do. My adrenal glands don't. You need steroids, it stops you going into shock. I have this in tablets, and if I'm sick or in an accident, I have injections, because you need steroids, you get very full with that stuff. So yeah, that's my hydrocortisone. The reason I have to take hydrocortisone is because of these steroids. These are nasty steroids. We call them Satan's Tic Tacs in our house. They also get called ugly pills, certain Smarties, demon tablets, prednisone, whatever you want to call it. It treats inflammation. Asthma is a condition partially caused by inflammation. What stops that? It's very effective. It also destroys you. It suppresses your adrenal glands because it creates so much steroid that your adrenal glands don't need to bother. Some adrenal glands, like mine, just forget to start off with again, which is why I take the hydrocortisone. I'm on a reducing dose of these. In the next couple of weeks, I'll get down to 10 milligrams, which is the lowest I've been on for a long time. Quite exciting. These do lots of horrible things. They make you gain weight, they make you very hungry, they give you insomnia, they can make you quite depressed. They aren't good for your bones, good for your stomach. These are horrible, but they work. You find a lot of asthmatics that have taken a lot of these hate them. However, it's what keeps us breathing, so we kind of have to work them to some extent. Because I'm on these, I also take Gazgy. They taste awful, but I've got the caplet version which you can swallow whole. They're like horse pills, they're huge, but they help protect your bones because the steroids aren't good for them. The interesting thing about these is that I'm too young to see if I have bone damage from the steroids. You have to be 21 to get a DEXA scan in my area, which is pretty disgraceful because I'm on a medication that can destroy my bones, but I can't see if it is destroying my bones or not because I'm too young. So if in a year we find out I do have any degree of osteoporosis, it's unlikely, but it's possible, then that's a whole year of treatment that could have stopped it or slowed it or even improved it. But no, I'm not 21. Part of the stomach destroying properties of steroids is I take Metformin. It's a proton pump inhibitor. It makes the stuff in the stomach less acidic, which means that if it refluxes at all, it's less damaging to the areas. I also, we're a bit in between, I also for that take, I'm on metoclopramide. I'm not currently taking it. I started this last week and I felt hideous, really busy, really sick, really tired, couldn't actually get out of bed and things. I need to go back to my GP because the other drug I was on isn't good for your heart. So I need to talk to you about that. I then, because asthma is obviously quite an allergic type condition, I take an antihistamine, pretty standard, over the counter, quite easy with hay fever. I get it on prescription because it's cheaper to do it that way. I take a double the normal dose of that, because it doesn't work for more than 5 hours in them. Really good. The other drug I take is Montelukast, which is just an asthma treatment, but it's anti-allergic in asthma. Completely forgotten what kind of drug it is. Might be the leukotriene receptor agonist. I don't know. But it works. It gives you funky dreams, which is quite nice. Very vivid dreams. So I quite like that. Just on the standard dose of that. Also, if I do have an allergic reaction despite the antihistamines, I have these ones. Again, that's Piriton, I think, is the brand name of that. They make me sleepy, so I try not to take those. But if I'm reacting to something, sometimes you can just take it and just have a little kick. I take this. There's a bit of a question mark over this one. It's not good for your heart rate, but for me I find it really effective with my breathing. It's a bronchodilator. It's quite a nasty drug. It can make you feel quite sick. I get this IV in hospital. Yeah, but I worry that it might be causing some of my heart problems. My heart, I take this Ivabradine, and I take Lemonade. For a long time I wasn't on anything. Then I was on Verapamil for a little bit, but that's been stopped. Because I have inappropriate sinus tachycardia, so I have a fast heart rate when I shouldn't. And for ages I thought it was just that. I got a lot of, you're just anxious, you're panicking, you're worrying, which turns out not to be the case. I also, because of the salbutamol, the blue inhaler that is known with asthma, that can increase your heart rate, and so a lot of them will just say you're just overusing that, it's fine, it's just an effect of that. And I would say, it's been days since I've had any, or it's been hours, or it's gone up since I've been taking less, and they will say, no, it's just salbutamol, it's just salbutamol. Turns out it's not. It was also attributed to phenephrine for a long time. A lot of cardiologists just wanted to stop this and not start any heart meds, and the respiratory doctors saying she needs the heart med, the phenephrine, and they saying, well, why add something, you need to take something away. All very complicated. Eventually, I had to be cardioverted, so they had to zap me to get my heart going right, which was when this was started, Aberdeen. And the Verapamil was stopped long because it wasn't working properly. I then had some IV aminophylline over this, and had more SVTs, again, it's quite poorly, so that's when this started. So far doing really well. My resting heart rate used to be about 130, 140. We're down to about 80, which is really a lot better. I feel a lot better in myself, less tired, a lot better exercise tolerance. A lot of problems with the heart meds, because young people don't take heart meds, and so lots of heart meds have horrible side effects, and so some of them sat down and said, I don't want to do this to you because you're young and still want to live your life. You know, there are medications that mean that you can't really go outside because the sun will just burn your skin, or make you really sensitive to light, or can cause lots of problems if you're on them long term. And that's one of the things that is quite common for young people to experience, is that you can't take some of the medication because you can't be on it for your whole life. And so if you're on it now, that means there's nothing of use further down the line, potentially will deteriorate. Which does make it really difficult and is a really under-recognised problem, and that's why there needs to be a lot more research into treatments for younger people that you can be on for your whole life, or for as long as needed, because otherwise we have to experience symptoms that you wouldn't make someone else experience just because you can't treat us for it. I take Atrovent with bupropion. You can have that nebulized or in the inhaler. I take the inhaler. It's, I've opens up your areas. It's quite commonly used in COPD, so chronic bronchitis emphysema, diseases that long-term smokers quite commonly get. It works reasonably for me. I notice it. I notice when it's missing. It's not made a huge difference, but it's quite, worth taking. Inhaled treatments tend to be quite good in asthma in that it treats your lungs directly, which means that there's less side effects elsewhere, not in the mouth and the throat. I have this, which is a very good drug. It opens up your ears. It does a similar thing to the blue inhaler, but in a way that lasts a lot longer. So you take this regularly to prevent problems. I have these little ampules of steroids. I nebulise these. I have 2 twice a day. These are a bit of pain because they take a long time to do. They also destroy the inside of your mouth, so I get a lot of pain in my mouth. I get ulcers and things like that, because this isn't good for my mouth. Lots of washing and stuff. Typically, another nebulized drug. These are little round ampoules. Again, 2 of those are 4 times a day. I tend to do them more 3 times a day just because of the amount of space in between, because these, again, increase your heart rate, and so I've got to be careful that I'm not making myself poorly. That's increasing the breathing. It's all a balancing act. I then have, because of the medication I take, particularly the Unitrin and the Bechamel, make me feel quite sick. And so I have Trump, which is a very good drug but very expensive. It's got often used in cancer patients to treat side effects of chemo. So I have that, and I also have Buxton. I find that's less effective, but the great thing about that is that you just put it there and let it absorb. So if you're actually feeling sick, you don't have to worry about that, because it will still get into you without you having to swallow it. Pain relief. Again, I get a lot of chest pain from my breathing, I get joint pain and muscular pain because of steroids. So I have paracetamol, obviously, and tramadol, which is strong painkiller. Obviously, you don't want to be taking as much of that because it's an opioid-based one, and so you cannot take it, you should not take it. There's a paracetamol. If it's virally, you find pretty side effects, so to me personally it's completely side effects. I then finally have fluoxetine, an antidepressant. I take 2 of those a day. Currently working on what antidepressants I take. These aren't doing amazing things for me. I still get quite a low mood, quite anxious sometimes. But ideally, because I'm being referred to psychologists, I'd rather deal with it through talking therapies than drug therapies. Drugs have their place, talking has its place. If you can get a combination that works, brilliant. It's quite difficult being a young person with a physical health problem and taking antidepressants, because people see it as a good explanation for everything. I've had lectures in my knee when I'm in with my breathing about my antidepressants, which is unnecessary because I'm not in about my depression or anxiety, I'm in with my breathing, and my breathing is bad for a physical reason. And it's silly to waste time talking about these, and we need to be talking about all this other stuff. And we need to be talking about what we're doing about my breathing now. It's also quite poor that if you're a young person and you have a consultant that's concerned that there's a psychological component to your physical problem, even if you're saying they're not and there's no evidence that there would be, they can get you referred to a psychologist that day. I've been seen the same day, and I know people with real struggles with their mental health that are on waiting lists for months and months and months to see someone when they need to, and I am seeing someone the same day and I've done it. and that's disgraceful, and that's not fair on them, that's not fair on me, and it's a waste of everyone's time, because I could sit on a waiting list for 2 years when I'm breathing, but these people can't, and yet they're getting pushed to the back of the queue so that I can get told, don't worry, it's a physical problem, not a mental health problem, which just makes no sense, because that's what I was seeing in the first place. I'm a young person, and so obviously I have to be anxious and stressed. It's not true. Finally, over the counter, I take multivitamins, pretty standard. Figure why not? Feel rubbish, you eat rubbish, and it's not going to help fight infections, things like that. If you're not having vitamins in you, and your body just gets rid of anything you don't need, so I'm not the end of the world. And I also take magnesium, which is used very effectively in me in emergencies with my asthma. And lots of people have said good things about it long term, so it's something that I'm trying, seeing if it makes a difference. I have been much better with it recently, but there's been a lot of medication changes recently, so I'm sort of giving it a go. I might stop it in a few months for a bit and see how it feels without it. It's pretty harmless and it's a bit more natural than some of these things. Not completely natural, but more so, slightly better. So giving that a go. So that's pretty much all my treatments. I have a few strepsils and such like for pretty run-of-the-mill stuff, but that's what I take. A lot more than my grandparents take, it's a lot more than anyone I know, in my friendship groups and stuff, but I need it all. It all makes a difference, and everything that I'm on currently, the benefits outweigh the side effects, which is sometimes a tough balancing act when you've got mental health problems, but currently we've got a mixed bag. So yeah, right, thanks.